In a stunning twist of events, Dr. Melissa Drake, a respected figure in obstetrics and maternal health, has come forward with evidence that casts doubt on Meghan Markle's narrative surrounding the birth of her daughter, Lilibet Diana. These revelations, supported by meticulous documentation and expert testimony, have sent shockwaves through media circles and royal enthusiasts alike, raising serious questions about the authenticity of Markle's claims. Since stepping back from royal duties alongside her husband, Prince Harry, Meghan Markle has dominated headlines, often presenting herself as a misunderstood figure battling the pressures of royal life. However, the Duchess of Sussex has faced ongoing scrutiny for inconsistencies in her public statements. And Dr. Drake's findings might represent the most pointed challenge to her credibility yet. Dr. Melissa Drake, a board-certified obstetrician with over 20 years of experience, has built her career on precision and factual integrity. Her expertise in maternal care has made her a sought-after voice in medical controversies. In this instance, Dr. Drake reviewed hospital records, timelines, and statements from medical staff who were allegedly present during Lilibet Diana's birth in June 2021. Her findings reveal glaring discrepancies between Markle's public account and the documented events. One of the most significant inconsistencies involves the timeline of Lilibet's arrival. Meghan Markle previously claimed that she gave birth in a serene and private setting at Santa Barbara Cottage Hospital, surrounded by a carefully chosen medical team. However, Dr. Drake's analysis of hospital admission logs and staff reports suggests that Markle arrived at the facility under far different circumstances, hours later than publicly stated and without prior arrangements with the hospital's maternity team. This revelation directly contradicts Markle's narrative of a well-planned, intimate delivery. Adding another layer of intrigue, Dr. Drake uncovered evidence that royal protocols were not followed during Lilibet's birth. Traditionally, the births of royal children are meticulously documented and verified, with official announcements closely aligned with actual events. In this case, reports suggest that Meghan and Harry bypassed these customs entirely, opting instead for a private announcement that lacked verification by royal officials. This deviation raises concerns about the motivations behind their secrecy, especially given Meghan's ongoing critique of royal traditions. Dr. Drake's findings also challenge the timeline of the birth certificate's registration. Official documents were reportedly filed days after the widely publicized birth announcement, further fueling speculation about the accuracy of the information provided. When questioned about these delays, representatives for the Sussexes offered vague explanations, prompting critics to accuse the couple of deliberately obscuring details to control the narrative, the most damning aspect of Dr. Drake's revelations lies in their implications for Meghan Markle's broader media strategy. Critics argue that Markle has consistently positioned herself as a victim of both the monarchy and the press, leveraging her personal life to garner public sympathy. If Dr. Drake's findings prove accurate, they could undermine Markle's credibility, exposing her as a figure willing to distort the truth for personal gain. For instance, Meghan's portrayal of Lilibet's birth as a peaceful and empowering moment contrasts sharply with the chaos described in Dr. Drake's report. Eyewitness accounts from hospital staff suggest a far more dramatic scene, with security personnel allegedly enforcing strict confidentiality measures and limiting access to maternity wards. Such actions, while understandable for a high-profile couple, contradict the image of calm and openness that Markle has sought to project. Unsurprisingly, these revelations have sparked intense debate across social media platforms and news outlets. Supporters of Meghan Markle have dismissed Dr. Drake's findings as speculative, accusing her of perpetuating a smear campaign against the Duchess. However, critics argue that the evidence warrants serious scrutiny, particularly given Markle's track record of questionable claims. Royal commentators have also weighed in, with some suggesting that this controversy could further strain relations between the Sussexes and the royal family. If Meghan and Harry were truly committed to transparency, they wouldn't shy away from addressing these inconsistencies, one commentator remarked. Instead, their silence only fuels suspicions that they have something to hide. Dr. Melissa Drake's revelations represent a significant challenge to Meghan Markle's carefully crafted public image. While her supporters may dismiss these findings as baseless, the evidence presented raises important questions about the accuracy of Markle's claims and the motivations driving her media narrative. As the public awaits further clarification from the Sussexes, one thing is clear: the shadow of doubt now looms large over Meghan Markle's account of Lilibet Diana's birth.